Welcome to the Chiropractic Patient's Owner's Manual, otherwise known as the New Patient Orientation class. I'm Dr. Steve Hansen from Back in Action Chiropractic Center, and this is a workshop that I try to get every one of our patients to see, because I consider this kind of it's the owner's manual of chiropractic. So why are we here? Well, I know as a man that I don't really like to read owner's manuals. I go and buy something and then I bring it home and I start using it. And a lot of times I don't use it to its full capacity. I mean, recently I got a food processor for my wife, and I use it kind of like a blender. But when you take out the manual, you realize that it chops, it slices, it dices, it does a lot of work for you. So I get much more out of my purchase by reading the owner's manual. So I want you to get the most out of your care by understanding how chiropractic can benefit you beyond making your back feel a little bit better. So let's talk about that. All of us have a common goal, and our main common goal when most people come into a chiropractic office is to get their back pain, their neck pain, and their headaches to go away, or at least reduced or managed somehow. And frankly, I'm really good at doing that with people. But we really want to feel better, but we also want to have a higher level of health. And so sometimes when I say that in these workshops, people say, what the heck does a chiropractor have to do with being healthy? I just want my back to feel better. But really what you're going to find out is that chiropractic helps you achieve a higher, maybe an optimal level of health, that when you experience that, you can experience life even at a higher level. Okay? So if you want to know what health is, or if you want to achieve a higher level of health, it's important for you to understand what is health. So when I look up health in the dictionary, it says that, and this is from Dorland's Medical Dictionary, that health is a state of complete physical, mental, and social well-being, and not merely the absence of symptoms and disease. So that says that health is not only, it's not just telling what health is, but it's also saying it's not just about feeling good, right? When I look at Webster's dictionary says that health is 100% function of all parts of the body. To me, that's easier to understand. If all your parts work properly, then you're going to be 100% healthy. And probably at this point in our lives, not many of us are 100% healthy, but we want to be as close to that 100% as we can be in order to feel good, to function well, and to really live the life that we want to live. But yet we know that health does not really pertain just to how we feel, but most people judge our health by what? How they feel. So Dorland's Medical Dictionary says that health is 100% function of all parts of the body, not just the absence of symptoms of disease, yet most people judge their health by how they feel, right? So, which can be a mistake if you think about it, because the top 2 killer diseases in the United States right now are, number 1 is now cancer. 1 out of 3 people are dying of cancer, and number 2 is heart disease. 1 out of 4 people are dying of heart disease. And if you think about it, you don't have any symptoms in the early stages of those diseases. And if you wait till the symptoms tell you that you're in trouble with those diseases, chances are you're having a heart attack at that point. We don't want to wait till you have the symptoms to realize that you have a serious disease. So all of us have heard of somebody, or maybe we know somebody who we thought, boy, he was so healthy, and then he just dropped dead of a heart attack. But healthy people don't drop dead of heart attacks, but symptom-free people do. So it is a common mistake that we make, especially in our society, to judge our health by how we feel. Okay? So when do most people go to the doctor? Most people go to the doctor when they feel sick. And what does the doctor give them? Medication. So if you think about how that works, well, let's look at the statistics. In the United States, we as the United States use up about 5%, we take up about 5% of the world's population, but yet we consume about 75% of the world's prescription drugs. How's that working out for us? Well, according to studies, it says that according to a new health analysis bearing the revealing title, U.S. Health and International Perspective, Shorter Lives, Poorer Health, it says in the article that Americans come in dead last in a comparison of the 17 most affluent nations. We're at a dead end. We've come now to a fork in the road. So you have to make a decision now. Do I want to judge my health by how I feel and then try to medicate myself into better health? In my opinion, and a lot of other people's opinions, better health doesn't come through better chemistry. It comes through getting your body to work at a higher level to reach your optimal health. And there's 5 pillars of health that we need to take into account when looking at how our health works. Number 1 is, a lot of people know this, diet. What you take in your body plays a huge part in your health and how well you function. PMA means positive mental attitude. You got to have a positive mental attitude. It's been proven that people with bad attitudes generally have a poor level of health. You got to move a lot. You got to exercise. You got to do what you can to keep your body strong and to give it the fitness that it needs. And of course, we want to manage stress properly, because stress is really the bottom line of all health conditions. But the last pillar I have on there talks about our nerves. Everything in our body is controlled from our brain. And the brain talks to the body by sending messages through your nerves, through your nerve system. So it's really important to maintain a healthy nervous system, and that's where chiropractic comes into place. It says in Gray's Anatomy that the nervous system controls and coordinates all organs and structures of the human body. It doesn't say some of the time. It doesn't say some of the structures or some of the functions. It says all the time. The body is controlled by the brain through the nervous system. So when you think about it, the nervous system is probably the most important part of your body, because it controls everything. It's so important that when we were created, God encased our spinal cord in bone, and He encased our brain in a skull and a helmet. The nervous system is the only system entirely encased by bone to protect it. And then you have your spinal column protecting your spinal cord. When the brain sends signals through the body, it's doing everything it can to make sure that there's a communication line between the brain and the body, so you can have all the functions of your body working properly. If there's interference in that communication line, something's going to go wrong. Just like it says here, when there's no interference, your nervous system controls the healthy function of virtually every cell, every tissue, and every organ and system in your body. That means when there is interference in the nervous system, something could go wrong. What could cause interference to the nervous system? Well, your spine. Sometimes the spine doesn't line up right, or maybe it gets jolted out of position and locked in the wrong position. And when that happens, the bones can actually put pressure on the nerves, causing a change in the function of that nerve. We call this a vertebral subluxation. Vertebral means spinal, and subluxation actually breaks down literally to less than a dislocation. In fact, if you're having a spinal dislocation, you probably would want to go to a chiropractor. There's probably more of an emergency room, and it's not going to come out well for you, most likely. But a spinal subluxation is a small misalignment in the spine that puts pressure on the nerves. And it can cause a lot of other things to go wrong. Biomechanically, when the spine doesn't move properly, the spinal bones don't allow for the proper transmission of your body weight to go through the joints of the spine, putting pressure on the joints, which can cause pain and an increase in the arthritic degenerative process. Neurologically, when the nerves get pinched, stretched, pushed on, pulled on, that message going through the nerves no longer works the way it's supposed to, and whatever's at the end of that nerve is not going to get the right message, or maybe a garbled version of the message. So if that nerve is going to your heart may be told to beat slower or harder or faster than it's normally supposed to. And then when you go to the medical doctor because you have a heart problem, he will never tell you to go to the chiropractor. He'll tell you to take this medication, or maybe he'll tell you to get some exercise, which would be a great idea too. Okay? So we want to make sure that that nervous system is working properly. And then when the spinal bones misalign, that cause that degenerative problem, that can cause problems in your discs, your joints, and lead to an accelerated state of arthritis. So how much misalignment does it really take for the vertebra to be putting pressure on the nerve? According to the American Board of Neuroradiography, it takes about 1 millimeter of misalignment to put pressure on a nerve, and enough pressure to cause a decrease in nerve function. That study was followed up by a doctor named Dr. Chu out of the University of Colorado, who found out that the weight of a dime, 10 millimeters of mercury of pressure on a nerve, could decrease nerve pressure or decrease nerve function by up to 40%. Which means if you have minimal pressure on a nerve going to, say, your heart, then whatever's at the end of that nerve may only be working at about 60%. Now we're in trouble, because you don't feel your heart beating. You don't feel your lungs breathing. You don't feel your digestive system working unless things are going wrong. So if you wait till you have pain, you've probably waited till there's a lot less function, and now we have bigger issues. And when you break down the anatomy of a nerve, when you cut a nerve into a cross-section of a nerve, you're going to have millions of nerve fibers in there, and those nerves are divided up into 3 general kinds of nerves. One is sensory, how you feel. Okay, so if 10% of the nerves in the body are dedicated to feeling things. So if you are having an issue in that nerve or an issue in the body, you may not feel pain till way down the road, way down until that problem's been there for quite some time. In fact, in my experience, that's what happens. Most people come to my office after they've had pain for only a few weeks. But after doing my evaluation, looking at how the body has changed over time, I can tell the problem's been there for decades sometimes, rather than weeks or months before they come in to get help with the problem. About 40% of the nerves are dedicated to motor function. Motor function means muscle function. And then we can divide up that motor function into the voluntary, like your skeletal muscles, or involuntary muscles like your heart or your intestines. If those nerves are being hindered anyway by the subluxation, well, you can experience problems in those muscles, whether it be spasm or weakness or just simply not working the way you want them to work. The third kind of nerve in the body is a autonomic nerve. Autonomic is a fancy word for automatic. Think about the things that run automatically in your body: your heart, your lungs, your organs, and your glands. These are the things you don't think about working. In fact, if you had to think about all the time your heart beating, you'd be able to think about nothing else. You'd have to think about it literally all the time. And when the phone would ring, you'd be done for. So we want to make sure that we allow the body to work at its best by making sure that the brain can continue to send messages through the spine out to those organs and tissues to make them work properly. We don't want to wait until we have pain to address the problem. So when chiropractors talk about wellness care and preventative care, well, that's just it. We want to prevent the illness and the symptoms by keeping the body well, making sure the brain and the body can communicate. And that's what chiropractic is really all about. Because if you allow nerves to be interfered with, that communication between the brain and the body suddenly gets hindered. The communication between the brain and the organ can result in dysfunction of that organ or tissue. And it's not uncommon to see improvements in health problems not commonly associated with a back problem. For example, I take care of a young lady, she's in her mid-30s, and she came in to see me for pain between the shoulder blades. So I did an evaluation like I did with you or I do with anyone else that I see. I evaluate someone from the top down. I evaluate the top of the neck all the way down to the bottom of the spine. I don't just go where the pain is. So we found some problems in her lower back, and she came in for her first adjustment, and I told her it takes a little bit of time to get the problem to be fixed properly. And she didn't seem overly excited about that, honestly. She wanted her pain to go away that day, and well, she got her first adjustment. So I adjusted where her pain was, but I also adjusted where I found subluxations. One of them was in her lower back. So that was on a Thursday, and she comes in on Monday, and she comes in with singing my praises. Man, she thought I was the cat's meow. She said, "I don't know what you did to me, but that was amazing." I said, "What happened?" She said, "Well, I didn't tell you this because you're a chiropractor." She goes, "I've had a problem with my bladder for the last 3 years. I've had to actually catheterize myself because I have a paralyzed bladder." So she had to put a tube up into herself to allow her bladder to be emptied every day instead of going to the bathroom like most people do. She said, "You gave me adjustment. I went home and I peed on the toilet for the first time in years." So did I fix her bladder? I really didn't. I took off the pressure, allowed the body to heal itself the way it was supposed to. So that's how chiropractic works. We take pressure off the nerve by adjusting the spine, and miraculous things happen. I've seen a man's hearing come back. In fact, chiropractic started from a deaf man regaining his hearing, and initially they thought they found the cure to deafness. But when they started taking care of the spine and of all these people, they started taking care of the nervous system, all these other problems started getting fixed. And that's how chiropractic was born. So a lot of people wait until they have a problem before they come in. Most people do. Most people come in pain and they want their pain to be fixed. And a lot of times we get that pain to go away fairly quickly. In fact, we always like to say that pain is the last to show and it's the first to go. So a lot of people, when they get their spine worked on a little bit and they start getting the problem healed, they feel better, they think they're done. And that may not be the case because sometimes that problem's been there for years and it takes time to train the body back into a new place. And if you let the spinal problems go for a long period of time, we often see an accelerated form of degeneration. And you can see on this slide here how there's several pictures of different necks or different cervical spines in different phases of degeneration. And the black line is where the proper curvature should be in the spine. And you can see how the curvature goes away, and now because of the lack of curvature, there's a lack of a shock absorption on those joints. And so now the discs, the dark lines between the bones start to get thin and break down. You can see how bone spurs and arthritis tend to form over time, and that's simply accelerated when you have the subluxations in place. Look, we're all going to have some form of degeneration as we get older, but it makes sense to me to keep it as slow as we can so we can continue to feel good and do the activities that we want to do all the way through until we're very old and the Lord takes us. So how do we get these subluxations? How did they get there in the first place? I think a lot of people tend to think that when you have a back problem, there had to be a certain cause of it, a fall off a roof or a car accident, and that can certainly happen. But really, all subluxations, just like every health problem, comes down to one word, and that word is stress. Now there's different kinds of stress. I think most people, when they think of stress, well, when I think of it, I think of physical stress, like trauma, right? What kind of trauma is there? Well, I put up the slide of the car accident. But really, when you think about it, it doesn't have to be getting hit by a vehicle or falling from a long distance or having some major event happen that can be a trauma. Think of the birth process, right? When you were born, if you came through the birth canal and not through a C-section, the doctor took your head and turned it likely almost 180 degrees to get your shoulders to turn so you could fit out properly. And then, well, that's usually when the first subluxation starts in most people. And people say, you adjust babies? We sure do. Because their little nervous systems are developing so fast that they have a subluxation. They may not have any pain, but they're not going to develop the way they're supposed to. So when my daughter was born, she was born, and she was born in a hospital, and the nurses took her and they cleaned her up, and they of course they put a tube down her throat to drain out all the amniotic fluid, and they're poking her feet to get blood samples, and they're doing all these tests, and then they swaddled her up into a blanket so she looked like she was in a burrito, and then they laid her down there and she was laying like this. And I'm a chiropractor, so I noticed these things, so I went over there just to move her head back into place, and it was kind of stuck. So I said to her mother, I said, I think I need to check her. And it was so funny because the nurses were there and they had just done all these things to her, and they knew I was a chiropractor. And when they saw that I was going to check her, it's like they grabbed the red phone to the back cave just to be on, he's going to check her. So I checked her, and the way I checked her was real simple. She's a brand new baby. She has no muscle tone at all, really, because she's been floating in a liquid environment for the last 9 months. I picked her up by her feet, and I looked to see if her spine lined up, which it did, but her head stayed crooked. So I said, I got to adjust her. So the nurses were freaking out. They said, he's going to adjust her. So I got my two-hour-old baby, and I adjusted her. And I used my pinkies and put just a little bit of pressure, and I held a sustained pressure on the very top of the neck, and I put in just a light pressure. And it felt to me like somebody went in from the other side and took her vertebra and pulled it into place. And I picked her back up by her feet, and her head hung level. So what did that mean? What did that do for her? To this day, I'll never know. But I know it made a big change in her because all those neurological functions that happen right between the brain and where the brain goes into the body, that all happens neurologically right there in the upper part of the neck. And if she's subluxated in the upper part of the neck, a lot of things can go wrong now and through the next several months or years. So let's say she didn't have that subluxation. She just went on to start living a normal life. Well, when kids get to be a little bit older, they learn how to walk. And when they're about maybe 10 months to a year old, they first learn how to stand. And when they learn how to stand, they'll look at you like, hey, Mom, Dad, look at me. And then they'll stand up like, look what I can do. And of course, what do? We cheer. And when we cheer, the baby startles and falls. And when they fall and they're brand new, where do they fall? Straight on their butts. And they put their hands in there and they land straight on their tailbone. Now, I've had a chair pulled out from underneath me before, and I know how bad it hurts to fall on my tailbone. But these kids get up and they just do it again. But they'll do it 3-4 times, sometimes a day. It'll put most of us adults in the hospital, but they get up and keep going. But there are compressive forces that are happening on that little lower back. And then when they get to be a little bit older, they learn how to walk at 18 months to 2 years old. And now their heads are roughly the same size as their torso. So they start walking, and they may see a ball or whatever the toy is that they want to play with. So they start running for it, and they get a little bit top heavy. And next thing you know, they're doing a Pete Rose slide across the kitchen floor and whiplashing themselves several times a day. That's trauma. It may not hurt them physically, make them feel a lot of pain or beyond a few minutes, but those things all add up. And then they learn how to ride a bike, and they fall off those several times, or they climb a tree, and they get in all kinds of trouble as kids like we do, and they're constantly falling and hitting themselves all the time. These are parts of growing up. But we're taught to rub some dirt on it and keep going. Well, we need to get those kids checked sometimes. And then they get a little bit older, they get into contact sports like football and wrestling and baseball and soccer, and we wonder where all these traumas are coming from. Well, that's where they come from. We still want them to play those sports. We need to get their bodies able to be able to take those hits more effectively, which is keeping them strong and keeping them alive. All right? And then as they get into I used to say teenagers, but now really it's pre-teenagers. They get into their phones and their computers and their devices, and they constantly have their heads out forward like this and looking down. They literally have a condition now in the medical world called tech neck. These neck and upper back issues because these kids are constantly looking down and never, their heads are always out in front of them, which makes the head feel a lot heavier. So all these different physical stresses in life are causing the problems, and as we get to be adults, we now go into the chiropractor and we say, well, I've had this problem in my back and neck for the last, 2 weeks. The problem's probably started years ago. So the earlier you get checked, the better. And if you have subluxations, take care of them. If your kids have subluxations, take care of them. Don't wait till they hurt. Okay? Another kind of stress is mental stress, right? How many times have you gone to work or come home from work and you're just gripping the steering wheel so hard, and those stress causes problems usually in the headaches and neck pain and shoulder pain. Why? Because all these muscles get tensed up. We grit our teeth. These muscles connect to the spine and they pull things and lock them in place and pinch nerves. So mental stress can cause or contribute to the subluxation pattern. Okay? The third kind of stress is chemical stress. Stressful thoughts, stressful traumas or physical traumas, and then there's your food, bad water, bad air. So your thoughts, traumas, and toxins are the stresses that all of us have to deal with all the time, and none of us can ever escape them. So we have to learn how to manage it better. So we manage our stress, we manage the food and the things we take into our body, and then we try to avoid those physical stresses. But ultimately, you got to take care of your body by make sure that the subluxations aren't present from all the stresses you had in the past. So once you find out you have these problems, how do we fix these subluxations? And chiropractors are the only professionals trained to locate, detect, and manage or eliminate subluxations. So I've been doing this for about 20 years. And I've seen every kind of patient from a newborn to my oldest patient is 99 years old, and she still drops in on a regular basis and keeps her body working well. Now she's moving a little bit slower than the rest of us, but she's doing really well. How far will your chiropractic care take you? That's your choice. How you choose to benefit from what we do is always up to you. But to get the most out of chiropractic, it's the best idea to correct the issue, not just relieve it. Look, when people first start coming in, they go through the process of relief. And in the process of relief, we're trying to get the body to start taking on a new alignment. And by getting joints moving properly, getting pressure off the nerves, we tend to reduce pain pretty quickly. But because the body's so used to being in the wrong position, muscles work on memory. When we start getting it working properly, the body tends to pull things right back out of place. That's why there's a need for some consistency with your care. But as your body takes on these new alignments and starts to adapt to a new normal, we don't have to see you as often. So we go from a relief stage to now let the body make a correction. Because once the body finds relief, the body goes, oh, this is how I'm supposed to hold myself up. So now the body takes time to let certain muscles elongate or shorten and get the body back into an alignment or back into a balance. And then at that point, it needs to strengthen it for a while. So once you make that correction, your body's not only functioning better from a joint in a biomechanical standpoint, but from a neurological standpoint as well. And you have less of a chance of this coming back anytime soon. So then we're going to recommend to you wellness care. Wellness care is once you make that correction, the chances of it coming back in time are good because you're still going to go back to the same habits and stresses that got you here in the first place. So a wellness care is basically when you drop in for a lube, oil, and filter just to make sure that things stay working well. And if something old is viewing its ugly head again, then we can stop it. And if something new is also showing up, then we can nip that in the bud as well. So that's my goal with you. That's my goal with everyone that I see is let's get you through this crisis. You came in here probably because you had some kind of pain or problem. Let's get you feeling better, but let's correct the issue. At that point, it's easy just to maintain things and have your body working at a much higher level from now until all the way well into the future. Okay? What's fun about for me is when people are on the wellness care, they're going through the full correction, that's when we see the miracles happen in conditions that you wouldn't expect to see in a chiropractic because it's not back pain. Look, I've seen, like I said, changes in hearing loss, digestive issues, a lot of headaches are helped with chiropractic care, bedwetting, sexual dysfunction, we talk about bladder problems, all these things can be helped with chiropractic. Ear infections. Kids who get ear infections, they get chiropractic care, the ear infections often go away. Not just, usually you take them to the medical doctor, you give them the antibiotic, which helps the ear infection go away at the moment, but then the ear infection tends to return. These kids under chiropractic care, they're finding that the ear infections don't come back because their body's just responding better. And there's mechanical and neurological reasons for that I won't get into at the moment. Okay? Here's a great article talking about boosting your immunity through chiropractic. The article is an older article, but it's based on a study done in 1975 by a guy named Pere. Pere was a chief of cancer prevention research at New York's Preventive Medicine Institute. So he wasn't a chiropractor, he was a researcher. And he wanted to find out why some people could never get cancer, but yet other people were very susceptible to it. He found a link between cancer and spinal problems. So he went on to do a study. He had a grant from the CBSRF, which is the Spinal Research Fund, and they began a research project at the University of Lund in Lund, Sweden. So what they wanted to find out, their hypothesis was that people with cancer should have a suppressed immune system, especially to a toxic burden. So while healthy people and people receiving chiropractic care should have a relatively enhanced response in their immune system. So they did the study, and in the study they had one group of patients out of all the people they studied, 105 or 107 people in the study, who constantly tested better in their immune competence. Their immune system simply worked better in every test they did. And the only common link that these people had was they were all chiropractic, they were all long-term chiropractic patients. Okay? So he said that these chiropractic patients had a 200% greater immune competence than people who had not received chiropractic care. And then when he compared those chiropractic patients with people with serious illnesses like cancer, these chiropractic patients had a 400% greater immune competence. So one time I was doing this workshop talking about this article, and someone says, "So you're saying that you're saying that chiropractors cure cancer?" I'm not saying that at all. I'm saying that your body has the ability to heal itself. And when you have subluxations, the body has less of ability to heal itself. So chiropractic raises the chance of your body to fight things like cancer or colds, or I've seen articles and research study on HIV patients living longer because of the chiropractic care. So chiropractic simply allows your body to work at a higher level. Just like Pere says in this statement, Pere concluded that chiropractic may optimize whatever genetic abilities you have so that you can fully resist serious disease. Optimize is a great word. Chiropractic doesn't cure anything, your body does. If your body's working at a higher level, chiropractic helps to optimize, make your body work at its best so you can fight disease, so you can live longer, so you can live more healthy, more active and vibrant lives. He says, "I'm very excited to see that without chemical intervention, this particular group of patients under chiropractic care showed a very improved response." We're talking about improved immune response. He said these changes occur from chiropractic treatment. So he didn't say anything in there about back and neck pain and headaches. He's saying these people can optimize their genetic abilities. So the people who want their bodies to work at a high level, these all-star athletes, often use chiropractic care. Every NFL team, every NBA team, every baseball team, all the teams out there have a chiropractor associated with them. Aaron Rodgers' father is a chiropractor. And he says that performing at my best is important to me, and it should be to everyone. Getting adjusted regularly is part of my goal to win in life and on the field. If you want to work at your best and perform in life at a higher level, chiropractic is probably right for you. And again, going through the process of relief, correction, and then maintenance care and wellness care. It's not a magic bullet. I'm not saying that everything is cured through chiropractic care. All right. I've heard people talk, chiropractors who talk, and they do workshops like this, and they start saying things like, all you need is chiropractic care. In fact, there was a gentleman I listened to back in Atlanta when I was first going through school who on the radio said that he would inject himself with AIDS-tainted blood, and he wouldn't get AIDS because, well, he was under chiropractic care. I'm not saying that's the case at all. Your body can work at a very high level, but don't be stupid about it. Do the things that you need to do. Eat well, get good nutrition, move well, and get good exercise. Think well, keep your mind sharp and positive. But really, staying well adjusted is the cornerstone or the center of all that, because if you're eating really well and your lower back subluxations are causing the nerves in your lower back that go to your digestive system not to allow your body to digest properly, you're not going to get the most from your eating well. All right? The same holds true for exercise. If subluxations are preventing you from healing properly and building properly, then you won't get the most out of your exercise. So do what you can to keep your body working well, but make chiropractic a part of that. Now, at this point, you've just learned what more than 99% of the world knows about chiropractic care. So now you've got a little bit of a duty to help fellow humanity by telling people about what we do. Back in Action Chiropractic Center has grown, for the most part, by word of mouth. We've helped a lot of people, and it's usually by someone telling someone else about what we do. So if you know somebody who's been having health issues, whether it be back pain, neck pain, or headaches, or other things that maybe we can help with, send them my way. Give them my card. I'm more than happy to offer a complimentary evaluation to see if there's something I can do to help them. And if I can help them, we'll get started if that's what they want to do. If they're not a chiropractic case, I will certainly tell them that too, and we'll try to find someone who can help them. Okay? So tell the world about us. Thank you for watching this video and taking the time out of your schedule to hear a little bit more about what we do, and I hope that you gain some insight and some benefit from this. For watching this video, you're going to receive a special gift. But in order to redeem that gift, our front desk is going to ask you a question, and that question is, what profession was Aaron Rodgers' father in? When you answer that question, you'll get your gift. So for those of you who don't remember, Aaron Rodgers' father was a chiropractor. So when you tell our staff that, you can redeem your free gift. Thank you again for taking the time to watch this video and learn a little bit more about how chiropractic can benefit you. I hope you gain some insight, and I hope you get some benefit from this video. If you have any questions about what was brought up on here or anything else at all about your chiropractic care or your health, give me a call. You can contact me or you can email me, which may be more effective, and I'll be happy to answer those questions for you as best I can. Thank you again.